So, as I mentioned earlier in an earlier video, I have brought in some assertion reason type of MCQs that appear in the ICR AIEEAPG uh, exam, commonly known as JRF, for veterinary science. And today we talk about some of the assertion reason types of MCQs, possible assertion reason type of MCQs in veterinary gynecology and obstetrics uh, and artificial insemination. So we are providing some assertion reason type questions in VGO Unit 1, 2, and 3. And then we will be discussing about the match the following type of questions in VGO and then other type of questions in VGO. So here is the question, assertion, question number 1, assertion, dystocia in cattle is often associated with fetal maldisposition. And the reason given is fetal maldispositions hinder the normal progression of parturition. Now, the options given are both assertion and reason are correct, and reason is the correct explanation for assertion. Both assertion and reason are correct, but reason is not the correct explanation for the assertion. Assertion is correct, but reason is incorrect. Assertion is incorrect, but reason is correct. So, as you can see, dystocia is often associated in cattle and buffalo with fetal maldisposition, and even in horses and camels. The fetal maldisposition often lead to dystocia. Why? Because when the fetal leg or the fetal head is rotated or deviated, then it increases the space uh, of the fetus, and then the birth canal has a limited space, so this cannot pass through it. So, answer is A. Both assertion and reason are correct, and reason is the correct explanation for the assertion. Then the question number 2, assertion reason type. Second question: postpartum metritis is a common uterine infection in cows, and the reason is poor hygiene during calving and inadequate uterine involution can predispose cows to metritis. Now, the options given are both assertion and reason are correct, and reason is the correct explanation for assertion. Both assertion and reason are correct, but reason is not the correct explanation for assertion. Assertion is correct, but reason is incorrect. Assertion is incorrect, but reason is correct. So, as you can see that poor hygiene during calving is one of the most important reason for the resultant postpartum metritis. Birth canal is widely open at that time, and when the hygiene is very poor, the cows are in a unhealthy environment. Then the microbes in the soil in the environment will enter the uterus easily and cause postpartum metritis. So the correct answer is poor hygiene and incomplete uterine involution create an environment. Answer is A. Both assertion and reason are correct, and reason is the correct explanation for assertion. Right. So the next question: ovarian cysts can cause infertility in cows. Ovarian cysts can interfere. The reason is ovarian cysts interfere with normal ovulation and follicular development. The options are both assertion and reason are correct, and reason is the correct explanation for assertion. Both assertion and reason are correct, but reason is not the correct explanation for assertion. Assertion is correct, but reason is incorrect. Assertion is incorrect, but reason is correct. So, as you know that ovarian cysts are a very big cause of infertility in cattle, and ovarian cysts interfere not only with normal ovulation, but when they persist for pretty long periods, they cause pathologies in the uterus. Hyperactivity of the uterine glands, maybe sometimes leading to mucometra, uterine pathologies, and other changes in the animal, which ultimately hinder the normal ovulation and the establishment of the pregnancy, right? So the answer is A. Ovarian, the assertion and reason are correct, and reason is the correct explanation for the assertion. Then the next question, prostaglandin F2 alpha is used to induce parturition in cattle. Reason is prostaglandin F2 alpha causes luteolysis and initiates the parturition process. So similar options, assertion and reason are correct. As you know that during parturition, normal parturition also, the fetal cortisol it increases, that converts the progesterone into estrogen, and then estrogen then causes the luteolysis. This initiates a cascade of events leading thereby to the parturition. So parturition is induced, and it can be induced by exogenous administration of prostaglandin F2 alpha in dairy cattle after the 8th month of gestation, and even before that up to 5 months of gestation. Between the 5 to 8 months, it is said that prostaglandin F2 alpha receptors are very less, and that's why the prostaglandin alone will not cause luteolysis. So both the assertion and reason are correct, and reason is the correct explanation for the assertion. Right. Then next question: equine infectious anemia can cause abortion in mares. The reason is equine infectious anemia is a viral disease that affects the immune system, making mares more susceptible to infections and reproductive problems. Now, the equine infectious anemia weakens the mare's immune system, and it therefore leads to abortion. So both the assertion and reason are correct, and reason is the correct explanation for the uh, assertion. The next question, dystocia can lead to uterine prolapse in cows. The reason is excessive straining during parturition can weaken the pelvic floor muscles. When there is a dystocia, when fetus is stuck up, the animal is constantly trying to push the fetus out, but because either of the fetal abnormality or any other problem, the fetus is not able to come out. So there is a constant contraction, and this weakens the pelvic floor muscles. So after words, when the fetus is delivered, the contractions continue, and the weaker muscles, because the muscles are weak, and the vaginal musculature and the uterine musculature have become very weak, so they prolapse out, right? So both the assertion and reason are correct, and reason is the correct explanation for the assertion. The next question, brucellosis is a zoonotic disease that can affect reproductive health in cattle. The reason is Brucella abortus infection can cause abortion and infertility in cows. Both assertion and reason are correct, and reason is the correct explanation for assertion. Both assertion and reason are correct, but reason is not the correct explanation for assertion. Assertion is correct, but reason is incorrect. Assertion is incorrect, but reason is correct. You see, brucella is a zoonotic disease, and it can lead to abortion because the brucella organism reaches the uterus, and because of the uh, sugar in the uterus, that the brucella erythritol, the brucella grows faster. This causes fetal endotoxemia and placentitis. So that ultimately fetus dies and leads to abortion. So both the reason and uh, both assertion and reason are correct, and reason is the correct explanation for the assertion. Then vaginal prolapse is a common reproductive disorder in cows. Reason, hormonal imbalances and weak pelvic floor muscles can predispose cows to vaginal prolapse. Both reason and assertion are correct, and reason is the correct explanation for assertion. Both assertion and reason are correct, but reason is not the correct explanation for assertion. Assertion is correct, but reason is incorrect. Assertion is incorrect, but reason is incorrect. Look, vaginal prolapse is very common, is a common reproductive disorder in some breeds of cows, and hormonal imbalances and the weak pelvic floor muscles, they lead to the prolapse, right? So both assertion and reason are correct, and reason is the correct explanation for the assertion. Hydroallantois is a condition characterized by excessive accumulation of allantoic fluid. Hydroallantois can lead to dystocia and reduce fetal viability. Look, hydroallantois is sudden accumulation of fluid, maybe up to 200 liters, and uh, because the uterus becomes very distended, so the musculature is very weak, and sudden loss of fluids occurs when parturition occurs. So, due to sudden loss of that much of fluid, the animal may die, and because the fetus is small and the placenta is affected, the fluid is enormous. That can lead to difficult births. That's why both assertion and reason are correct, and reason is the correct explanation for the assertion. Then next question, antiprolactin drugs can be used to induce estrus in anestrus dogs. The reason is prolactin inhibits the release of gonadotropin releasing hormone, which is necessary for follicular development and ovulation. Look, the canine CL is prolactin dependent, and the uh, complete dependency arises at around day 28, 25 to 28 of gestation. So, if you want to bring your dog into estrus, you have to use prolactin, anti-prolactin drugs. And the commonly used drugs are cabergoline or bromocriptine. When the prolactin levels go down, there is spurt of release of GnRH and the dog returns to estrus. So both the assertion and reason are correct, and reason is the correct explanation for the assertion, right? Cryopreservation of semen is a common technique used in animal breeding. Cryopreservation allows for the long-term storage of semen and transportation of genetic material. So this is a simple question. In 1949, when Polge accidentally discovered glycerol for cryopreservation of spermatozoa, that was a immense discovery that led to cryopreservation of semen, because glycerol was then used as a cryoprotectant, and this assures the long-term storage of the semen. When semen is cryopreserved, the metabolic activity of the spermatozoa uh, goes to nearly zero, and they do not have any activity. Once the semen is thawed, then they resume the activity. So cryopreservation can allow for long-term storage, and you can transport the semen also very easily. And ideally, it is said that it can be kept for an indefinite time period. For cryopreserved semen can be preserved for an indefinite time period, right? Then the next question, sperm motility and morphology are important factors affecting the fertility of the semen. The reason is motile sperm with normal morphology are more likely to fertilize than oocyte. This is very simple question, because if the sperm does not have motility, how will it reach the fallopian tube to meet the oocyte? And then if the sperm has an abnormal morphology, then it will also not be able to fertilize the oocyte, right? So both the assertion and reason are correct, and reason is the correct explanation for the assertion. The next question, epididymitis can affect sperm quality and fertility. You see, the sperm maturation, it occurs in the epididymis. So if the epididymis is inflamed, it can lead to uh, the poor quality of the spermatozoa, because the maturation of the spermatozoa occurs in the epididymis. So if the epididymis is inflamed and damaged, then the sperm maturation may be affected, and this can affect the sperm quality and the fertility, right? Then the next question, artificial insemination is a widely used technique in animal breeding. Reason is artificial insemination allows for the use of superior sires and genetic improvement of livestock. You see, in veterinary science, artificial insemination is one of the most significant technique which has allowed the use of superior sires and which has improved the milk production and improved the breeds at many places of the world, around the world. And since transportation of cryopreserved semen is easier, so it has improved and it is one of the most widely used technique in animal breeding worldwide. And also, wherever artificial insemination is the only method of breeding, a uh, venereal disease, Campylobacteriosis, has become non-existent because we add antibiotics in the semen diluters and semen is diluted. Then the antibiotics kill the Campylobacter even if they are present. Both Campylobacter and Trichomonas can survive minus 196 degrees centigrade temperature of the liquid nitrogen. But the antibiotics, they kill they kill the uh, Campylobacter, right? Then the next question, semen extenders are used to increase the volume of semen. Semen extenders provide nutrients and protect sperm cells during storage and uh, transportation. They not only increase the volume, but they also provide the nutrients. They act as a buffer to maintain the pH of the semen. So both assertion and reason are correct, and reason is the correct explanation of the uh, assertion. So these types, maybe these are simpler ones, but a bit complicated may appear in the JRF in veterinary science. So I think these types attempting or listening to these types of questions will help you out in attempting and scoring in JRF. We will be providing mock test as well in the GNP Sir Classes app, and we will be providing mock test in the uh, WhatsApp group. So kindly join our WhatsApp group. Kindly download the GNP Sir Classes app, and in the free material section, you will get much of the reading material, much of the MCQs as well, right? So hope this will help you out. Kindly, if you like this video, do share and subscribe. Kindly come, give your likes, give your comments, and if you wish that I bring more and more videos of similar type, kindly do subscribe to the channel GNP Sir Classes official YouTube channel. See you in the next video. Till then, bye bye.